Hello, Manasa. I'm Dr. Suri. Thank you for coming in today. What can I do to help you?
Hi, Dr. Suri. So basically, I just want to know what's been going on with me because there's some problems that I've been dealing with and it's starting to impact my daily routine.
No, I totally understand that. Tell me, what kind of symptoms have you been experiencing?
I actually wrote all of them down. So essentially, I've just been having a lot of trouble with numbers. Some of these issues are like counting backwards and forwards, reading and writing numbers, transcribing between numbers written in word and number form, comparing numbers and determining which one is smaller and which one is larger, performing mathematical operations such as adding and subtracting, interpreting mathematical symbols, aligning numbers in columns, and sometimes I just forget the number of days or weeks in a year.
All right, yeah, I see. I'm sorry you've been dealing with that. That must be very difficult. All right. Have you had any previous medical issues or injuries that could be related to these difficulties?
Well, actually, yeah. About a year ago, I had a stroke that affected my left side. And since then, I've started to notice some of these problems, especially with numbers and such.
All right, thank you. That is very important information. A stroke can certainly impact various cognitive functions, including numerical processing. So, this is your parietal lobe, where most of this activity is going on for your number processing, visual perceptions, things like that. This area of your brain specifically that we are discussing at the moment is your left inferior parietal cortex, which this was most likely damaged during your stroke, and it is known to be involved with numerical processing.
Okay.
I want to test out to see how severe your condition may be. Can you solve this problem for me?
Yeah. That's too difficult. I don't know.
It's all right. Try your best.
Is it 54?
It is not, but it's all right. We will go ahead and figure this out, Ms. Manasa. I'm going to ask you a couple more questions to assess your condition, if that's all right?
Yeah.
All right. I'm going to write down a sequence of numbers for you, and you just tell me what comes next.
Okay. Oh, that one's easy. It's 10, isn't it?
All right. It is not, but it's all right. And then one last little test. How many fingers am I holding up right now, Manasa?
1, 2, 4, 3, 6, 8, and 10.
All right. And then how many fingers am I holding up now?
1, 2, 4.
All right, Miss Manasa. Have you been experiencing any different kind of memory deficits, language difficulties, or executive function impairments? This could be impairment in having difficulty planning things, organizing, problem solving, even just self-regulation and just being directed at goals.
Yeah, I feel like I have to constantly depend on other people, like my family and my friends, to help me out because I can't seem to plan or problem solve by myself. But to be honest, the numbers issue is probably bothering me the most.
I understand that, Manasa. Thank you for the insight, and I bet that it must be very, very difficult for you. I'm going to go ahead and diagnose you with secondary Acalculia. Primary Acalculia usually occurs in isolation, without any other neurological symptoms or underlying disorders. But basically, when the stroke, like in your condition, primarily only affects areas involved with numerical processing. That's why I've asked if you've had an impairment in other areas as well.
Okay.
This actually takes me back to my undergrad days when I used to be a research assistant in a neurology lab at the University of Missouri. What university do you go to?
I go to the University of Missouri St. Louis.
Oh,
Oh,
perfect.
I didn't know.
Sister universities.
Mm-hmm.
But I chose to study this case study of JD because the patient and I were similar in age at the time, and also it was very interesting to see someone at 22 years of age being impacted by a stroke.
Mm-hmm.
I also pursued this study to look into possible applications of the research, to further look into how our different brain regions contribute to specific learning disabilities.
Okay.
I wanted to see if this research could be applied to further improve learning techniques as well as learning more about different learning disabilities such as Acalculia. By applying this knowledge, we can figure out ways to benefit the learning experiences of those with learning disabilities.
Oh, that's really interesting. I didn't know you did research. Can you actually tell me more about JD and her acalculia?
Of course I can. JD's neurological disorder stemmed from a cerebral infarction in the left parietal cortex in the area of the IPS with no involvement with major white matter tracts, resulting in her Acalculia. Here is an MRI image that shows exactly where in the brain this left inferior parietal cortex is.
Okay.
So it is going to be right here. This is your right side, and this is your left.
Okay. Well, when I was dealing with my stroke, I actually remember learning about a cerebral infarction, and I think my doctor told me that it's when the blood supply to a part of the brain is interrupted or reduced, depriving brain tissue of oxygen and other nutrients. And I think he said the interruption in blood flow was caused by a blockage in an artery supplying the brain, or by the rupture of a blood vessel in the brain. Is that right? Do I remember that correctly?
Yes, ma'am. What you are describing right now is either an ischemic stroke or a hemorrhagic stroke.
Oh, okay.
You have definitely done your research, Marissa. This can be seen by the loss of gray matter on the left side compared to the right one.
Oh, okay.
JD's cerebral infraction made her show deficits in basic numerical processing tasks, such as arithmetic calculations, procedural knowledge, and enumeration. JD also experienced difficulties in substitutizing, which is the ability to quickly and accurately add up small quantities without counting. Do you feel like you have been experienced that same?
Yes, that actually sounds just like me. That's crazy.
All right. This is actually great because I can use my previous knowledge and research to help you in your condition.
Okay.
JD's condition improved drastically due to the plastic structural brain changes, which is essentially an increase in gray matter. Gray matter changes were shown even in 1 week after the massive rehabilitation she went through during physiotherapy, number processing, and executive function exercises. Therefore, the best treatment option for your Acalculia will most likely be cognitive rehabilitation therapy aimed at improving numerical processing skills. Nowadays, cognitive therapy and occupational therapy is also used to treat this disorder.
Oh, I'd like to see it and try if that helps me too. But yeah, thank you so much, Dr. Sonia.
Of course, I'd be thankful to JD as well.
Thanks, JD. May I just know, how did this case advance knowledge and understanding of the brain / nervous systems, or promote research or new medical treatments for other related cases?
Yes, of course. Well, this case significantly advanced knowledge and understanding of the brain and nervous system by providing insights into Acalculia following a stroke, particularly regarding the role of the left inferior parietal cortex in numerical processing. Her study shed a light on tactile enumeration and subtitizing, revealing patterns of response and deepened understanding of these processes in the tactile modality. Additionally, JD's rehabilitation trajectory highlighted the brain's capacity for neuroplasticity and recovering after that stroke, offering valuable insights on mechanisms underlying cognitive rehabilitation for numerical deficits. These findings have implications for the development of targeted interventions and treatments for Acalculia and related numerical impairments, ultimately informing future research directions and clinical practices in our field of numerical cognition and rehabilitation.
Thank you for sharing your research with me. It actually makes me interested in getting into research myself.
I'm very glad.
Yeah, am I free to go now?
Yes, ma'am. Please let me know if you have any other questions. Do not hesitate to reach out to our office. I will reach out in a couple days with a couple references of different cognitive therapies and occupational therapists in the area, so we can go ahead and get this treatment started.
Okay, great. Thank you, Dr. Suri.
It was very nice meeting you, Miss Monisa.
It was nice meeting you too.